any minute now. In fact, Doctor is here already. I'm just trying to promote him to the panel. Some technical hitches happen. You know, all of you have been here regularly, and these are issues that exist with Zoom. Dr. Nagarajan, how are you? Can I request you to start your video and unmute yourself?
The doctor is coming in 2 minutes, Mr. Maheshwari. Just give us 2 minutes, we'll start.
Sure.
Yeah.
So in the meantime, before we thanks Sadhguru for helping us always with putting us on with the best doctors from Nanavati. Thank you very much. And
it's a pleasure, sir.
So until we have Dr. Nagarajan coming here, I'm just going to take a few minutes to do some of the announcements that we normally put to the end. I'm going to ask our producer to show a video of the latest issue of Seniors Today magazine. Yeah, I'm sorry to do this plug, but you're part of the platform, and we may as well show you. So this is the latest issue of Seniors Today magazine. It is the January 15th issue of Seniors Today, and it is the story is about the most influential people. Just going to the content of the magazine. Looking ahead in 2022. So that's it. That's the Seniors Today magazine of the January 15th issue that has been out, and from the indicators that we get of the downloads, it's getting rave reviews. What else is happening with Seniors Today? We're all set to have the finale, the season 6 finale of Seniors Have Talent. And that is happening tomorrow, that is January 23rd at 11 a.m. So what I'm going to do is our producer will also put up the link over there in case those of you are interested. Please join us. These are the 24 top finalists who are there. And, we have the names over here. All of them are going to be there, and they're going to be singing. And I'll tell you the format. And this is until Dr. Nagarajan comes here. The format is that all these people, and some of them are 70, 80, 65, they're all for 60 plussers. And these people have been given 10 alphabets. Yeah. And from these 10 alphabets, they have to memorize the song. And tomorrow when they come, they will be given an alphabet by our judge, and they'll get 6 to 8 minutes. And in those 6 to 8 minutes, they will need to sing a song. Yeah, they will need to sing a song which is among the 10 alphabets. Remember, we have people who have come from all age groups. It is really entertaining, even if I say it myself. I've had great fun. I'm not a music guy. I'm just an enthusiast. I'm an enthusiast like you, but I really enjoy doing this. It's away from journalism, it's away from everything else, and it's good fun. We are still waiting for Dr. Nagarajan to come in. Do please put on the video and unmute yourself when he comes in. Yeah, so basically that's what it is. I'm sorry, we're doing this. Sometimes it does happen. Doctor is.
Hi. Good evening. I'm sorry, I'm running a bit late. We had OT and then patients in the OPD. I'm sorry.
I can understand. I can understand. We are intruding onto your time. So welcome all to Health Live at Seniors Today. We are delighted to have you with us. Dr. Ganesh Nagarajan. Dr. Ganesh Nagarajan,
That's
who
right.
is director of the Hepatobiliary, Pancreatic and Gastrointestinal division at the Nanavati Max Hospital in Mumbai. And he's going to be speaking to us about liver and gastric cancer, various forms of abdominal malignancies and care. A little about Dr. Nagarajan. He is, as I said, at the Nanavati Max Super Speciality Hospital in Mumbai. He has over 2 decades of experience. He was until recently at the PD Hinduja National Hospital, Mahim Khar, for 8 years, and before that he was a consultant surgical oncologist and liver transplant surgeon at the Bombay Hospital and the Fortis hospitals. An award-winning doctor. He is a fellow in Hepatobiliary, Pancreatic surgery and liver transplantation at a Hospital Beaujon in France. His areas of specialization include surgeries for the cancers of liver, the bile ducts, the gallbladder, pancreatic, resections for pancreatic cancer, colorectal, stomach, esophageal, and intestinal cancer, and the like. He's a member of the International Hepatobiliary Association, the Association of Medical Consultants, and the Association of Surgeons of India. Thank you very much, Dr. Nagarajan, for being here. We've been trying to get you in for almost a year now, but we finally managed to get you, and your time to speak with us. So, as you are aware, this is Seniors Today, and we have most of the people here are senior citizens, and
Right.
they would love to hear from you about the issues that we've discussed about gastric and liver cancer and the care for it and how to prevent it from happening. And then there will be questions that will come in from the audience, and we would request you to address it.
Right. Am I audible?
Yes, you are.
Great. So, and can you see my screen?
Yes, we can see your screen.
Great.
Mr. Maheshwari, you will just allow us screen sharing, please?
Yeah, we're giving you access to screen share.
Thanks.
And yeah. So, good evening, everyone, and it's really a pleasure to be on this platform. And interact with this entire group of seniors today. So, we'll just go through a few aspects of liver cancers that you would want to know about. So, overall, when we look at liver cancers in general, we're talking about primary tumors and secondary tumors, meaning tumors which arise from the liver and tumors which arise from other parts of the body but go to the liver. So, most common type of tumor that we see in the liver is what is known as an HCC, which is a primary tumor of the liver. It's also called hepatocellular carcinoma. Okay. And many, this got a wide geographical distribution, and a lot of in the last 2 decades we saw a lot of liver tumors or HCCs coming because of hepatitis B and hepatitis C. It's very interesting because in fact, the Southeast Asian countries have a lot of hepatitis B and C. So Japan, Korea, China have a lot of Hep B and Hep C, more of hepatitis B. And hepatitis C is a little more common in the Western world, in the US and Europe. And India would have a mix of both, and that would cause most of our HCCs. Some of the other HCCs would be probably because of alcohol, but otherwise most of them would be because of viral hepatitis, that is hepatitis B and C. The difference in HCC versus all other tumors is that HCCs come in the background of an abnormal liver and a cirrhotic liver. So in almost 80% of cases. Now what we are seeing is hepatitis B has got vaccination now. Most people have taken a hepatitis B vaccine. Both hepatitis B and C now, over the last 5 to 10 years, there are new drugs which have come in where it is completely curable. So we expect that in the next 2 decades, we will see a drop in the number of cases in HCC. There will be a drop in the number of cases of hepatitis B and C. But what we are seeing now is that because of obesity and because of long-standing diabetes, we are seeing a lot of tumors in the liver. We are seeing primary tumors in the liver, HCC, in the background of what we call as a non-alcoholic steatohepatitis, which is basically caused by long-standing diabetes and obesity. Sorry. So what we are now seeing is the hepatitis cases will reduce. The tumors in the liver, because of in the background of diabetes and obesity, will slowly go up. And that's a very interesting trend that we are seeing now. So these are all, there are various risk factors. I'm sorry, we will not go into any of these. But overall, a lot of tumors which are HCCs are treatable either by surgery or by what we call as ablation. Sorry, just give me a minute, please. Sorry, thanks. Yeah, sorry. So as I was saying, so this is the change in trend that we are seeing as far as liver tumors are concerned. The other moving. So as I said, a lot of these fatty livers, you can see in the picture there, the fat, because of obesity and diabetes, keeps getting accumulated in the liver. Slowly that causes what is known as a fatty liver. That fatty liver slowly leads to fibrosis over almost a decade. And then that leads to tumors in the liver and or cirrhosis. So this is something that are treated by liver transplant. Many of these patients are treated by surgery. Some are treated by our radiologists by either ablations or other procedures called chemoembolization or radioembolization. So there's a huge gamut of treatments which are available for these kind of tumors. Sometimes these tumors are spread and they spread to other organs, in which case none of these treatments would be feasible. And there are special medicines, oral medicines now, which are in the form of targeted therapy. And they've shown mixed results, but many of them hold great promise. There's also immunotherapy, which is coming up in a big way. So every day science progresses, and every day we are able to, every couple of years, there's a new drug which comes in, there's a new modality of treatment which comes in, and we are able to treat these patients better. Now, that was about the primary liver tumors, what we call as HCCs. Here, this is the other set of tumors called liver metastasis. Metastasis means there's a tumor somewhere else, and that tumor then spreads to the liver. So you can have spread from a colonic cancer or a rectal cancer, which is the most common, and then you've got any other abdominal cancer can spread to the liver. But what is what is highly treatable are the colorectal cancers which spread to the liver. So we have a lot of approaches. We do very aggressive treatments for these patients because we say that even with, when patients have multiple tumors in the liver from the colon or the rectum, we are able to treat them successfully. And when we do that, almost a third of these patients have a long life, even though it looks like an advanced cancer. We personally have developed new techniques called image-guided surgery, which has yielded great results. We are able to treat more and more patients. And just to give you an example, today in my clinic, I have seen 3 patients of colorectal cancer with liver metastasis, and almost all 3 of them were less than 50 years of age. So it's an alarming scene where we're seeing more and more young patients coming with cancers and aggressive cancers, and we're trying to go all out to treat these patients. So that is as far as colorectal, liver metastasis is concerned. I'll give you a brief background of gastric cancer, since that was the other request. So just give me a second. I'll just open that presentation. It's on the downloads. So gastric cancers, again, in India, we don't, by virtue of us being a huge population, we see a good number of all cancers. But otherwise, traditionally, gastric cancers are not India's cancer. It's more, again, Japan, Korea, a lot of Latin America, USSR. Those are the high-risk areas. But we also see a lot of gastric cancers. But again, as I said, even if we have a small percentage, I think our population is so huge that we end up seeing a reasonable number of these cancers. In our country, traditionally, gastric cancer, the epidemiology is again very interesting. Traditionally, we found that H. pylori infections. H. pylori is a bacteria that infects the stomach, and we found that a lot of patients with chronic H. pylori infections used to get gastric cancers. It's very common, and H. pylori is quite common in India. So it was usually seen in more of the lower socioeconomic strata of society. Now, over a period of time, we found that, and these used to cause what is known as distal gastric cancers, as in gastric cancers of the later part of the stomach. In the West, we used to see a lot of proximal gastric cancer, means in the first part of the stomach. Now, the proximal gastric cancers that used to be seen in the West were more lifestyle related. People would be obese, people would be eating a lot of junk food, and over a period of time, they would develop a lot of reflux in the stomach and the esophagus, and that would cause these cancers. Today in urban India, we are seeing more and more of proximal gastric cancers because we are mimicking the West in our lifestyle. So that is very interesting. Whereas in the rural India, we are still seeing a lot of distal gastric cancers because of H. pylori. So this is very interesting. Gastric cancer is a very indolent cancer in the sense that it doesn't have very obvious signs and symptoms. So a lot of patients come to us with an advanced stage of the disease. So usually, an unexplained loss of weight, or suddenly, people don't like to eat. They suddenly start losing weight. Usually the relatives notice that they've probably pulled down. Some of them, the hemoglobin is just suddenly drops down. These are all, signs and symptoms of gastric cancer. Some of them would just present as vomiting. Some of them would present as just severe acidity. So these would be the signs and symptoms of gastric cancer. It's not, many a times it could just pass off as, a stomach upset or somebody who's just burping a lot. But sometimes these could be the only symptoms and signs of gastric cancer. The best way to investigate a gastric cancer is to get an upper GI endoscopy done and do biopsies from there. Then we normally do a CT scan or a PET scan to stage the cancer. Often we do a laparoscopy to stage the cancer best. Often these patients will require surgery with or without a combination of chemotherapy or radiation. So today, most cancers are treated by multimodality treatment. That means it's not just surgery or just chemotherapy. It's usually a combination of two things. And that is very commonly seen in gastric cancers. But having said that, we, today with better and better chemotherapy, we are able to treat more and more patients successfully. So many patients undergo chemo first, we shrink the disease and then go ahead with surgery. We've got good success with surgeries, both for gastric and liver cancers. So with technology today, we have advanced to a level where these surgeries are very safe. Even in our own center, less than 1% is our mortality rates, which is similar to the world. So we've got, we've got state-of-the-art equipment. We've got state-of-the-art facilities, operation theaters, where we're able to cater to these patients. And a lot of these patients go home and get back to normal life, which is, which is the most rewarding part for us. And as I said, it's not restricted. Previously, we would think that cancers are a disease only of the aged or the elderly, but today more and more we're seeing younger patients. So I think it's important to be aware, and with awareness will come early detection, and with early detection we'll be able to treat more patients, and eventually cancer is no longer the dreaded C word. I think a lot of our patients are long-term survivors, and that should give each one of us a lot of hope. I'll end my presentation here. I'll be happy to take questions and interact with all of you. Thank you.
Thank you, Dr. Nagarajan. Thank you for this presentation. I do know that cancer treatment has leapfrogged to what it is right now, thanks to some enormous medical talent that we have in India. And can I stop screen share? Could I stop the screen share, Doctor, if I can?
Yeah, I'll stop it. We'll stop it here.
Great. Yeah, so, as I was mentioning, that cancer care has leapfrogged in a big way in the last 30 years. And we are really fortunate that other than, the good old Tata Memorial Hospital, now there are multiple centers, not just in Mumbai, but across the country. And it's really heartening, because those scenes outside the hospital were really heart-wrenching when you had queues of people outside the hospital and all of that. So it's really a very good sign that we have all of you out there who are attending to patients. We have a few questions that have come in, and what I'll do is I'll read them out and then give them to you for a response. First of all, Mr. DJ Santa Maria has said, "Thank you. Finally, you have an oncologist." Yes, finally we have an oncologist, and we've been having this series of health webinars since last year, since a year and a half now, and we've not had an oncologist, and so far.
I think the last year and a half has only been COVID, isn't it?
Yeah. So you mentioned about the C word, and there's a new C word that has come into the.
Yeah, it's pushed us to the background, I believe.
So we have a question from Mr. Ramesh Bhayani, who asks, why does gas accumulate and why does it take a lot of time to release that it upsets us? Now, I know this is not exactly a cancer-related question, but he's asked that. And how?
So I think it's a lot of these are irritable bowel disease, or what we call as dyspepsia. So these are common with age, and I think gastroenterologists are the best equipped doctors to treat this. It's important not to ignore this. It's a fairly common symptom, especially in the Indian population. Our diet is very prone to gastritis, and we have a lot of masalas, and so it's got to do a lot with our diet. We also have a highly carbohydrate rich diet as Indians, as vegetarians. So I think a gastroenterologist would be the best to treat you, I think. And I think you should not ignore the symptom for long. As I said, sometimes some of these symptoms can be the early signs of something more sinister. So you should visit your doctor, maybe your general practitioner, and if required, a gastroenterologist to sort it out.
Thank you. There's a question from an anonymous attendee who says, I had myeloma 15 years back. After radiation, it got okay. Every year I go for a test. M-band is not there. That means there's no cancer. I'm 75 female. Do I still have to go for a test every year?
Yeah, it's always better to go every year because, a yearly follow-up or a yearly checkup is always recommended. And there are times, though, beyond 5 years, we normally say that cancer is cured if there's no cancer at 5 years. But we do encourage everyone to go for a yearly check because there are times where at 7, 8, or 10 or 15 years, we do find a relapse. So especially when somebody has taken radiation, I think it's important to go for a check once a year. I think it's always worth it.
Right. Thank you. We have a question from Mr. Sanjay Bhatia, who says, I'm diabetic for the last 15 years. The readings are generally between 100 and 200, and I'm under regular medication. Doctor, you said that diabetes leads to liver cancer. So how can we avoid and take precautions?
So that's a good question, because if he's been having diabetes for the last 15 years, I think it's important to just do an ultrasound of the abdomen once in 6 months to look at the liver, because the liver is, as I said, if there's a fatty liver, then it is important that every 6 months you should get checked and make sure that there's no tumor that's developing. It's a simple test. Ultrasound is available usually, at every locality. There's usually a sonologist. So it won't take you too long. It's a 5-minute test and it's non-invasive. You can just do a quick abdominal ultrasound. And I think that'll save you a lot of trouble. And I think it just also reassures you that everything is okay.
Thanks. We have a question from Mr. Madhukant Pandya, who says, how safe is reverse surgery of ileostomy after colon cancer removals?
It's fairly safe. I mean, we do it very routinely. So I think what he means is an ileostomy reversal or a colostomy reversal. It is something that we do very routinely. It's a safe surgery. So it should not be a problem at all.
Right. There's a question from Sachin Kumar, who says, I'm suffering from IBS. Tablet Colaspa gives a lot of relief, but without medicine, how to get cured of it?
So IBS is a very complex problem which has got multiple factors, which include diet, which includes anxiety, which includes a lot of psychological factors, dietary factors, age-related. So it's not usually one single cause. And often in IBS, we find that its patients, get treated for years together, and various combinations of drugs have worked. Some have worked, some have not. Some patients. So, but it's a very complex, problem which doesn't have an easy solution. So, if a particular medication works for you, and most of these medications are, they don't have any side effects or long-term effects. So, if Colaspa works for him, I think he should continue it.
Doctor, there's a question about COVID and cancer, and does COVID have any impact on cancer if one is already cancerous? There have been some issues about people who are going through chemotherapy, and the fact that they are more susceptible. And could a long COVID case also lead to issues which could then be cancerous?
So per se, COVID doesn't will have no impact on the cancer per se. What it does is that it does collateral damage, in the sense that if somebody is on chemotherapy and they develop COVID, because of the chemotherapy, their immunity is a little bit on the lower side, which is why they may take longer to recover from the COVID. It may be more severe. Sometimes because of the COVID, they're not able to, and if they have lung issues because of the COVID, then the chemotherapy gets delayed and the cancer can progress. So it's all, there are various, it affects the dynamics of the cancer treatment. Over the last 1.5, 2 years, we have seen that a lot of patients come to us with in a more advanced stage of the disease because they've not, they've put up with their symptoms because they're just scared to go and get checked. And because of that, when they finally got checked, they came with advanced cancer. So that is something that we've seen on the whole as a community. We're seeing more and more advanced cases of cancer because a lot of patients are just sat at home in spite of niggling symptoms, saying that okay, we'll ignore it. Why go and expose ourselves? Why go and get tested? So unfortunately, that's something that we've seen. So COVID has had its effect on cancer in different ways. So, but yes, I think that's something that we have to now learn to live with, and hopefully this should be the tail end of the pandemic.
We'll come to we'll ask you a question on that because you are at the hospital even right now, so you will know more. We have a few questions which have come in about just preventive care. So I'll just read out all the questions and then. So Nimish asks, how can one keep our liver healthy while aging? Naveen Chandra Shetty says, does eating spicy food increase chance of gastric cancer? Mr. Malcolm Montero says, would you give us tips, doctor, as to what precautions we can take to prevent gastric and liver cancer? And Mr. Narendra Shah says, what preventive measures to prevent liver cancer and gastric cancer? So all of them are the similar thing. What does one do to prevent? What does one ensure to have a healthy inside, healthy gut, healthy liver, etc.?
So I think we'll put all of these together, and I think I think the key in so often cancers don't have a particular cause. As I said, in liver, of course, at least we know that many of them are hepatitis B and C. So one thing I can tell you is that if in the 80s, 90s, or even up to the early 2000s, if you've received blood transfusions at that point of time, I think it is important because India was not screening blood for hepatitis C for very long because it was not, it was not mandated. It's only after 2000 that blood was screened for hepatitis C. So a lot of people who received blood transfusions in the 80s and the 90s, we find now, with incidentally hepatitis C and tumors. So if you've received blood in the past before 2000, it's good to get yourself checked for hepatitis B and C. I think that's a simple thing you can do. Diabetics, I think get a screening ultrasound. Long-term diabetics or obese individuals should get screened, and of course cut down on obesity, treat your diabetes, be aware of dietary changes as far as diabetes is concerned. The better diabetes is controlled, the better obesity is controlled, the lesser the chances of fatty liver and subsequent tumors. Gastric cancers, again, there's no clear-cut cause, but often H. pylori, which is not treated, is one of the causes. So I think people with a lot of gastric issues in terms of, in India, it seems to be almost okay to keep to burp away and, it's okay to have a lot of people just live with acidity and gastritis all their lives, where, often when they have checked, they find it's H. pylori and it needs a 2-week course of antibiotics and it settles down completely. So that's another thing that should not be ignored. Diet per se doesn't really cause or prevent cancers, though of course a healthy diet is always good. Apart from that, I think anything else that
I think these are the questions basically. And is there any exercise that you would recommend that people do?
So exercises are always welcome, though it's not going to doing extra. Often we find patients who come to us and say, I've lived all my life. I've not eaten non-veg. I've not smoked. I didn't drink, and I still got the cancer. So, so it doesn't. But of course, I mean, it always is good to have a healthy lifestyle, but it doesn't always correlate. So at the same time, of course, we know that smoking and alcohol, smoking definitely, and alcohol in excess can lead to a lot of cancers. So it's always important to cut down on that. Smoking is a definite no. I think that's important. But apart from that, I think just a healthy lifestyle, but then those who have to get it will get it.
Right. Thank you. We have a question from Katie Dadanji, who's 70. Doctor, my maternal uncles, one died of liver cancer and the other of pancreatic cancer. My maternal grandfather died of cirrhosis of the liver. Should I do liver tests regularly, and what precautions should I take? As she said, I'm 70 years old. And she also mentions that my 45-year-old son has a mildly fatty liver. What precautions should somebody like him take?
So I think it's more about getting, cutting down a few kilos of weight for the son. I think just cutting down on the central fat, cutting down on borderline diabetes, eating less carbs and more proteins, less fat in the diet. I think that should do the trick. Mild fatty liver can be reversed, so I think that's important. Genetically, I don't think that, liver cancers are not primarily genetically spread cancers. So no specific tests need to be done. She can always get an ultrasound done as a routine health check, but there's nothing really recommended unless she has some symptoms.
Right.
I can see somebody who's put a chat, and Madhukant Pandya, and so I think he's one of my patients. So it's so nice to see him on the group. So thank you.
Yeah. We have a question from Mr. Vilas Wani, who says, I have lower rectum cancer after operation of fistula. Now, colonostomy had done in 28 radiation with 8 cycle of chemo, but size of CA not decreased or increased. And now doctor suggests for extensive chemo and then surgery, and CA is mucinous.
So mucinous tumors. So mucinous tumors probably don't respond very well to chemo. So sometimes a longer course of chemo is required. But apart from that, it's very difficult to comment without actually seeing the scans. But we do see this variant of cancer quite regularly. And sometimes we just change the chemotherapy a little bit. Sometimes or often these patients complete the course of chemoradiation and then we go ahead with surgery, and that's what usually cures them.
We have a question from Mr. Sachin Kumar. He mentions the name of the doctor which I'm going to avoid, but he says, I've been treated for H. pylori in 2015 and 2018. Why does this happen? Why does a frequent episode of H. pylori happen?
So H. pylori is commonly caused by food contaminants. So it's usually, eating food outside or water which is contaminated. It's usually by what we've taken in. So that is what causes this.
Doctor, there's another question which has come in about if we do want to take. I'm not from Mumbai and I do not have access to the Nanavati Max Hospital. But if one does want to consult you for a second opinion, is it possible through video or phone?
Yes, we do online consultations, and maybe Sadhguru can just provide the details. And we have a very robust telemedicine option where we do teleconsults on a routine basis. Especially in COVID now, this has become quite common. And patients, especially from out of town, for second opinions, we are most happy to help you. So Sadhguru will provide you with the details and the email ID, and you can get in touch with us, and we'll be happy to help.
So as always, we carry the edited extract, edited video, as well as the takeaways, which we, Doctor, I must tell you, we have a qualified doctor who does the takeaways on every edition of Health Life, and we will be having that on Monday, and we will mention your coordinates for the telemedicine.
Sure. I can also see Sanjeevani Jadhav, who said hi, and hi. So she's another very, very special patient of ours. So I'm sure she's doing very well.
Thank you very much, Doctor. Thank you for taking so much of your time. Doctor, I can't let you go without really asking you about what is the, you are up close with the situation of COVID. What is the scene that you have at the hospitals that you get a view on? Is it really ebbing right now? Is it safe for the world?
I wish I knew. What we can say is that it's definitely getting less virulent in that sense. So this time around, I think we're seeing much lesser admissions, much lesser ICU, much lesser patients who are severely sick. But overall, I hope, and that's, if you go by the normal trend of viral infections, they mutate to a level where they cause less and less severe infections, and finally, just remain like a flu. And hopefully, I think we are getting there. So I hope that we can all resume our normal lives and normal travel and socializing, which I think all of us have been missing. Otherwise, I would have loved to meet all of you and maybe have a physical meeting. And hopefully, maybe next year we can do that.
Absolutely, Doctor. And you all are on the front line, and we need all of you to be well and able to take care of any issues that are there. But it's a healthy sign that we're saying that we have things are not coming into the ICU, and the numbers, at least in a city like Mumbai, that are being reported are low. Thank you very much once again, Dr. Nagarajan, for your time here and for sharing your thoughts and the knowledge about liver, gastric cancer. And thanks to your team for having facilitated this. We will be back once again, as always, for our health webinar next week. Next week, we have Dr. Vikas Punamya, who is going to be talking about sleep apnea and various sleep disorders for the elderly. So that will be next week, which is January 29th at 5 p.m. as always. Once again, thank you, Dr. Ganesh Nagarajan, for...
Thank you so much. Thank you. It's a pleasure being here. Thanks. Really a pleasure interacting with all of you. Thank you.